All right, here we go. So this is going to be chapter 5, medical terminology. You'll hear us refer to this as med term. Guys, we're not going to spend a ton of time lecturing on this. This is going to be simply you going back in your textbook and through your notes and memorizing this stuff. There's not a whole lot of variance as to how you're going to have to know the stuff. It's just you got to have it memorized. Okay.
Did you say at one point, I think last week, that some things online?
Yes. Yeah, I'll talk about that.
Some of the ones.
Because that's part of your homework. I know I haven't posted it or sent it out an email. I'm going to talk about it today. I just need to type out the details and upload it and send it out through an email. But yeah, that's going to be part of your homework for this module. We'll talk about that. So guys, midterm is really important. Why? Why do we need to use this? Okay, so there's a standard across the board. Different things mean, the same thing universally in the medical world.
Well, you got to be able to communicate to the other professionals, right?
Yeah, you've got to be able to effectively communicate, like when you're given these verbal reports or these radio reports. Guys, some of this is like luxury. Instead of saying a word that's 17 syllables, you can just use like an abbreviation that's 3. Some of it's convenience. But there's some of these terms that, especially if you pick up a patient from like maybe a nursing home or from another facility and they have a chart with them, you're going to be able you're going to need to be able to transcribe that chart with that medical terminology, with those abbreviations, all of that stuff too. So guys, these words and abbreviations are going to need to be a second language. All right. You're going to use them day in and day out in the medical field. So just make sure you are actually retaining this stuff and not just cramming and dumping it, because these things aren't going to go away. All right. So we'll understand some key terms, some acronyms, abbreviation symbols, all that fun stuff. All right. So guys, just going back to like language arts. Do they still call it that in school, language arts? Okay. So what is the root word or okay, so the main part, like kind of what we're basing the whole meaning of that word around. All right, what is a prefix? The beginning of a word. We can tack on some of these prefixes to kind of change the interpretation or the meaning of that root word. All right, a suffix goes at the end. All right. All of these things these language art, kind of the base knowledge of how words are formed, still apply to medical terminology. There's still some really annoying English language spelling stuff. So if you make like maybe one word plural, it's still pronounced the same, or it changes the vowels when you make it plural. That's annoying. It's still just going to be there. Kind of like the conjugating stuff in Spanish. I hated that. So just kind of showing you how they're going to be pieced together. All right. So phasia with an S. All right. So that means speaking. So you notice here, phasia and phasia, they sound the exact same. There's just one letter difference, but they mean two completely different things. All right. So phasia with an S means speaking. All right. S, speaking. Phasia with a G means eating or swallowing. All right, the quirky way I remember that, phasia with a G means that you can't get stuff down to your gut. Phasia with a G, gut, means eating or swallowing. Okay. Dys, D-Y-S, in any context is going to be have the definition of painful or difficulty. So if you put these words together, dysphagia with an S means they're having difficulty speaking. Dysphagia with a G means that they're having trouble swallowing, which is telling me they probably can't control their airway very well. All right, you can have a patient with one of these, depending on how it's spelled, or you can have a patient with both, dysphagia and dysphagia. So again, guys, pay attention to spelling, pay attention to these root words and how they are combined to kind of interpret what's being meant.
In the field, like what's the appropriate way to clarify how it is like this?
Like in a radio report.
Like if you're like giving a report one.
I mean, you can just say either with an S or with a G, or you could say, you know, difficulty speaking, difficulty swallowing. You can like kind of not like spell it out, but yeah, it just depends. Sometimes it's very obvious what it is, but based on the patient's presentation. But sometimes you can just say, hey, it's the way that it's spelled, or just tell what it means. All right, so again, guys, the root words are going to be the main source of what we're talking about. So let's take cardiopulmonary, for example. Where did you hear that before?
Is referring to the
Cardiopulmonary
heart.
resuscitation, right? CPR, that's what CPR stands for, is cardiopulmonary resuscitation. Anytime you see the term cardio or cardiac, that's going to refer to what? Heart. Pulmon or pulmonary, lungs. All right, so in CPR, during the act of CPR, we are resuscitating the heart and the lungs. That's the main goal. Okay, so just combining that together kind of tells you what we're doing when we perform CPR. We're pumping the heart and we're breathing for the lungs. Prefixes in med term world usually are going to describe like a location or an intensity. A means without. Okay, so asystole. What does that mean? Yeah, so without a heartbeat, without any electrical activity in the heart. Nothing's there. Apneic. What does that mean? Huh? No breathing. All right, pnea or nia, depending on how you say it with that P, that silent P. Put the letter A in front of it. Apneic or apnea means that you're not breathing at all. So anyone ever heard of the term sleep apnea? That means that you stop breathing in your sleep. Okay. Brady is one that you're going to need to know. What does Brady mean? Slow. All right, so if I say my patient is bradycardic, their heart rate is slow, slower than it needs to be, slower than normal. If my patient is bradykypnic, that conjugation there kind of changes the pronunciation. They're breathing way too slow. All right, tachy is another one you guys are going to hear a lot. It's not CKY, like, oh, you're so lame, you're so tacky. TACHY means fast. If my patient is tachycardic, their heart rate's way too fast. If they're tachypnic, they're breathing too fast. All right, guys, when it comes to these, sometimes you'll hear somebody say they're bradycardic, or you might hear somebody say, yeah, they're bradying it down, or their heart rate's brady. Yeah, they're tacking out at like 150. Their heart rate's high and it's around 150. Okay. Suffixes is pretty much going to tell you condition or disease of. That's usually how we see it in med term. So breaking down this word, itis. I got the itis. All right, what does that mean in any context? Inflammation, swelling. Okay. Arthro, means joint. Put those together, arthritis. You've got inflammation of your joints. Okay. Again, combining the vowels, sometimes the pronunciation changes. So just be used to, it's not like, so like we just said, like bradykypnic or tachypnic, it sounds a little bit different because those vowels, but it's still going to mean the same root word and the same prefix type thing. So sometimes you will see cardiac or cardio. Sometimes you'll see gastric or gastro. Anything with that O, but that main root word is there, it's still going to mean pertaining to like the same system or the same organ. It just might, again, have just a couple of different vowels in there depending on how we're combining the word. Gotta love the English language, right? So again, here we go from vertebra to vertebrae. All right, so that is the plural form of that. What is a vertebra? All All right, so these building blocks of your spine, that's a vertebra. And if you have more than one, it's vertebrae, not vertebras. Okay. So diagnosis to diagnoses. Gnosis is singular, gnoses is plural. Yeah. So again, prefixes, a lot of them can indicate numbers or colors. All right, so uni is one, bi is two, multi is many, null is none. All right, so guys, a lot of the same, just the basic language is going to be translate the same to medical terminology. It's just the way that they are kind of glued onto each other. Colors are important to know. We already talked about cyan means what? Blue. Blue, because remember that definitive sign of death, one of that definitive sign of death is profound cyanosis. All right, if your patient is cyanotic or presenting with cyanosis, that means that they have blue tint to their skin. That is not good. That means that we are not having oxygen flowing. Luke or leuco.
White.
White. Where might we hear this term? Okay, so leukocytes. Okay, the white blood cells in our body. Erythro. Red. Where might we hear that? Erythrocytes. Your red blood cells. The fancy pants term for red blood cells is erythrocytes. Okay, red cell. Sero. Yellow. Mm-hmm. So typically, if you have like maybe cirrhosis of the liver, then you can appear with that yellow color. Melon or melano.
Melanoma.
Yep, melanoma, melanin. All right, so positions and directions. I think we go over. All right. Ab. What does that mean in directional term? Anybody know? Can you define the country of origin? So moving away from something. Okay. We'll get to a slide when we talk about that. Add.
Oh, I understand your question now. I wasn't understanding. I'm sorry.
Yeah, no worries. Add, A-D.
That means coming into or
Coming in towards. All right. So circling. Around. Friends. Through. Across. Yep. Epi. Above. Supra is also above. Somebody's got some echo on his mic over here. All right, so direction. So it's really, really important to remember when we're referring to directional terms, when it is dealing with an assessment or a location of something. It's the patient's directional, right? Because if I'm standing in front of my patient and I'm looking at my patient, if I say, oh, if he says, let's say, this arm hurts, grab an arm. All right, okay, I'm looking at my patient, that's my left side, correct? If I'm facing my patient. But if I put myself in the patient's perspective, is that their left side or their right side? That's their right side. So whenever we talk about left versus right, it is the patient. Whatever position they are in when we're noticing it, it's the patient's left or right. That gets confusing sometimes because it's easy to say, oh, okay, that's on my left, it's the left side. But really no, turn yourself around, put yourself in the patient's position. It's going to be opposite. If you're facing the patient, it's opposite of whatever your side is. Okay. What does superior mean? Above. All right. If you have a superiority complex, right, that means that you think that you're above everyone else. Inferior. Below. Okay. Lateral. Okay, so further from the midline of the body. Like, right, if I take a line and I cut myself in half going this way, lateral is going to be further away and medial is going to be closer to. Proximal and distal is also kind of the same. Proximal is going to be further away. I'm sorry, proximal is going to be closer. Distal is going to be further. It's a further distance away. Okay. Superficial, close to the surface. Shallow, if you say, man, that person's superficial. They're shallow, right? You only hear about like the things at the surface. And then deep is deep, further below the surface, right? All right, you need to know these. What is ventral and dorsal?
Front side, back
So
side.
it's referring to the front and the back of the body, right? So ventral is going to be the front aspect. There's another term you're going to hear that's a lot more common than ventral, and that is what? Starts with an A.
Anterior.
Anterior. A-N-T-E-R-I-O-R. They're two different words, but they mean the same thing. Ventral and anterior refer to the front of a surface of the body, whatever we're talking about. Okay. Dorsal, where do you see the dorsal fin on the dolphin? The back. All right, so dorsal is referring to the back side, or the more commonly used is going to be what? Posterior or posterior. Depends on how you pronounce it. You'll hear me say posterior, but posterior is not wrong. All right, apex, what is this? So not necessarily the top, but where a structure comes to a point. All right, so you'll probably, when we talk about like the lungs and the heart, we'll talk about the apex of the heart or the apex of the lungs, where they come to a point. That's gonna be what apex is. All right, so again, this is going to break down superior is near to the head or on top of, inferior is near to the feet. Guys, you need to keep in mind with these directional terms, a body part could be due to two different things. All right, let's take the elbow, for example, or no, let's take the belly button. The belly button is what to my pelvis? Superior. But with comparison, my belly button is inferior to my clavicles, right? So it's not gonna, that directional term is not gonna be concrete. It's just going to be in relation to what other body part you're comparing it to. Okay, so my elbow, all right, let's take a step back too. When we're talking about these medical terms, especially the directional terms, all right, what am I basing this off of? Yes, we talked about it's the patient's directional, but what am I basing it off of? The what position? The what? The anatomical position, right? You need to remember that, especially when it comes to the hands, because it's a little bit different than what you would normally expect, right? This is the anatomical position. All right, feet are spread shoulder width apart. You're standing upright, you're looking forward, and your palms are turned to the anterior side of your body, right? Your palms are turned outward. This sometimes throws people off because if you're like standing in line at Starbucks or wherever waiting for your drink, do you normally just like rest and stand like this? Can't wait for my coffee. No, we normally have them turn the other way. This is not the technical anatomical position. So make sure you are aware that the palms are turned outward when it comes to these directional terms, because that drastically changes, especially what terminology for, let's say, the palms of your hand. Maybe anterior and posterior, right? Because based on the anatomical position, the palms of your hands are on the anterior portion of your body, right? But if you stand like this, they're posterior. So just remember, that's how we base it off of. All right, so when it comes to lateral and medial, okay, well, actually, let's do distal proximal. So my elbow, anatomical position, my elbow is what to my shoulder? Distal to my shoulder, right? It's further away from the core of my body. But my elbow is also what to my wrist? Proximal. It's closer to my body than my wrist based on the anatomical position. Okay, so we can interchange these directional terms, it's going to have the true meaning depending on what you're comparing it to. Everybody okay with that? We use superficial and deep when it comes to maybe cuts or burns or any type of soft tissue injuries. And we'll talk about that the longer or the further we get into the course, but just that's kind of the relationship we use those terms for. So again, anterior, posterior, ventral, dorsal, same thing. So palmar surface, where do you think that's going to be? The palm of your hand. Plantar surface. Think of like a plantar wart. You normally get those on your feet. So the bottom soles of your feet. Again, apex is going to be the tip of the structure where it comes to a point. All right, so flexion and extension. All right, think about going to the gym or exercising with this stuff. All right, when you flex, you're showing off your gun, you're showing off your muscles, right? You're bringing it where? You have to do this action, bringing it towards your body to flex those, those muscles, right? When you're extending something, you're doing what? You're moving it away from the body. Think about flexion when it comes to flexing your muscles. You're bringing it towards your body, or you're doing this, whatever Arnold Schwarzenegger pose you want to do. But with extension, think about have you ever like hyperextended your elbow or something like that when you like go to catch yourself and you move away from your body to catch yourself and it goes a little beyond what it needs to. So flexion, extension towards the body, away from the body. Okay. This is important to remember when it comes to the GCS that we're going to talk about, but just remember those terms. And then again, adduction and abduction. What did we say ab means? Away. So moving away from the body, away from the midline. If you ever hear the term like child abduction, that means somebody came and took that child away from their home, moving away from the body. And then add, you're adding, surface area or whatever to the body. The numeral terms, well, not numeral terms, kind of. This is a very important one that you're going to hear a lot. That can make or break whether it's a good assessment or a bad assessment. All right, so lat is going to mean side. If you hear the term bilateral, what does that mean?
Both sides.
You've got something on both sides. All right, so I have clear lung sounds bilaterally. All right, that means both of my lung sounds are clear on each side. I have kidneys. I have bilateral kidneys, right? I've got two of them on each side of my body. Bilateral eyes, ears, anything that I have on both sides or that they're equal on both sides would be bilateral. Okay, unilateral, what does that mean? One side. You might hear the term unilateral chest rise. Do you think that's good or bad? Bad. What is bilateral chest rise? Breathing. Both of my lungs are working. Both sides of my chest are rising when I breathe, right? If I had unilateral chest rise, what does that tell me? One lung's not working. Not a good assessment, okay? So the uni is going to be referring to one side, and then the bi is on both sides when it comes to the lateral term. All right, your abdominal cavity, okay, your belly right here. All right, starts from about here and goes to about here. It is very important that you label and use the correct terminology for these different areas of your abdominal cavity. We have 4 different quadrants. We are going to use right or left first. Always, always, always. So what is this?
Right, lower. Or no. Yes.
Right.
That's going to be your right upper quadrant.
Upper. So right upper quadrant. Yeah, because it stops there.
Your right lower quadrant.
All right, so this is not the upper right quadrant. This is the right upper quadrant. You will see this abbreviated as RUQ. It's not going to be URQ. That is not an acceptable medical abbreviation. So always use right or left first when we're referring to the abdominal quadrants. Okay, so this is my what?
Your
My
right-
left
your
lower
left
quadrant.
quadrant.
All right, so we've got right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Again, you can use abbreviations for those, but make sure your directional terms are in the correct order.
You go to say like, rough.
No.
Is it LL2 for left over?
Correct. All right, so some more that you need to know. Prone and supine. What is this going to tell you?
Position at
The
the bottom.
position of your patient, right? If you find, because this is going to be part of your chart, part of your documentation. How do you find your patient when you come on scene? All right, arrived on scene to find patient lying prone in the middle of 75 South. How's my patient lying?
Face down.
Okay, prone is going to be face down. Supine is going to be face up. So if you say noted patient lying supine in nursing home bed, they're laying flat on their back in their bed. Again, guys, the way you find your patient when you come on scene should be part of your chart, so you need to know these terms. Fowler position, you're semi-reclining with your head elevated. So that's kind of like you're sitting at like a 45-degree angle. Okay, it's a very common transport position. We make sure that the head of the bed, the stretcher is raised at like that 45-degree angle, that they're nice and comfortable. Semi-Fowler, again, you're in between that 90-degree, like sitting completely upright and then just slightly elevated. So now we can look, like especially if we are looking at a chart and we've got all these long medical term words. Guys, I don't expect you to know every single one out there in the universe, right? But if you have these common knowledge terms and abbreviations and phrases, you can kind of break them down, okay? So neuropathy, what do we think that means? Okay, so we're gonna look at, let's look at this root word, right? The neph or nephro, that means referring to the kidneys. Okay, what's another term that refers to kidneys? That's another organ.
Like the I just had a brain fart.
Starts with an R.
Renal.
Renal, R-E-N-A-L. If you see that, that's also referring to the kidneys. But nephro refers to kidneys. Empathy, that's going to mean disease of something. All right, so if we're not even sure how to pronounce this word, if we see that neph or nephro and then that pathy, okay, well, we got kidneys and we got disease. So, you know, kidney disease, neuropathy. That O is just kind of thrown in there to make it sound or look a little bit better / confusing. All right, dysuria. What does dys mean again? Painful or difficulty. And then ur is going to refer to urine. Ia, condition of. All right, so piece those all together. They're having difficulty or painful urination. Okay. Because again, guys, you need to, that dys, again, it can mean two different things, painful or difficulty. So again, look at the context clues, look at your patient presentation, ask those clarifying questions to see, well, does it burn or hurt when you pee, or you're not peeing at all? Because those can mean two different things. All right. Hyperemesis. Does anybody ever, or whenever it was going on, like the royal family, when Princess Kate was pregnant, she was hospitalized with each pregnancy for what? Hyperemesis. What does that mean? Break that down. Hyper means
Vomiting.
too much. Okay, excessive amounts. Emesis is the fancy pants term for vomiting. she had really, really bad morning sickness and was just constantly throwing up. But hyperemesis sounds a little bit more appropriate and a little more regal, right? So hyperemesis is excessive vomiting. All right, I hate this word, I can't say it, analgesic. So ick pertaining to an without. So remember that a also means without. And then alges means pain. So if you're giving someone an analgesic, then you're giving them a pain relieving medication. Okay, so we carry fentanyl on the ambulances. That's our analgesic that we administer to kind of take away pain for patients. Guys, again, I think I included them in here. These scans are on the Google Drive. All right, that really, really long chart in your book. I don't expect you to know every single one of them because that's not even every single one in the medical world, right? It would be nice if you were familiar with all of them, but I took the liberty of going through them and I highlighted every one you absolutely have to know. These are the ones that you are going to hear on a day-to-day basis at your job in the healthcare setting, okay? And if somebody says to you, oh, your patient is hypertensive, and you're like, they're what? They're gonna look at you and be like, I'm sorry, do you know anything about the medical field? Okay, because let's break that word down, hypertensive. Hyper is
High,
excessive.
excessive.
Tension is, or tensive, or tens, is, you know, literal stress or pressure. So if I say my patient is hypertensive, what do we think that might be referred to?
High blood pressure.
Too much pressure, excessive pressure. Their blood pressure's through the roof. It's high. What about hypotensive?
Low blood
Low means
pressure.
below or not enough. All right, so their blood pressure is low. They don't have a very strong blood pressure. All right, so again, this is going to be part of your homework. I'll tell you guys what that is when we're done for the day. I'll post it on the drive and I'll send out an email. Okay.
Set the on the table
5.9 and 5.10. Because that combines root words, prefixes, abbreviations, kind of everything you need to know. Okay. That's all I got for midterm. It's just gonna be memorization. All right. All right. Questions, comments, concerns on Zoom in class?
So what about the pop quiz or whatever?
Pop quiz. Okay.
Was there anything from yesterday? I know I didn't catch it, but
I don't
couldn't remember if you were
think I
doing it
can
every
tell
day.
you that answer straight up. But today, let's talk about today. Oh,
I didn't
okay.
mean to create one.
Oh, no.
Now everybody's gonna be mad at me.
You asked for it now. All right. So last night, my 3-year-old, we have monitors in both of their rooms just so we can make sure everything's okay. He tends to talk in his sleep. And last night, he gets like violent in his sleep too. He'll just like start lashing out, but he'll be asleep the whole time. So last night, he was yelling out that he wanted a sandwich. He was very angry too. He's like, I want a sandwich. And he was asleep the whole time. So yeah, if you could send me an email telling me what my 3-year-old yelled out in the middle of his sleep last night, that's your pop quiz. Thanks, Keith. Okay, anybody have any questions, comments, concerns on midterm? Everybody know?
You talked about homework due for
Yes. So questions on this chapter before I stop recording, and then we can talk about homework. All right.